Hi, my name is Haley Gillespie, and I'm a nutrition and fitness coach. In this video, I wanted to go over the kinds of exercise that I most recommend to maximize weight loss, slow the decline of aging, and improve immune function. I'll go through my top 5 types of exercise that I would encourage you to include in your regimen. If you're not familiar with any of these protocols, be sure to seek help from a trainer or other professional and make sure that you're medically cleared before starting a new program. Overall, strength training or resistance training, as you might hear it called, is going to be the best kind of exercise for helping you to maintain or build lean muscle mass, which is going to help you improve your metabolic rate. It's also going to help you create a better hormonal profile for both anti-aging and fat loss. And this is going to be an especially important type of activity if you're getting older, because we tend to naturally lose muscle as we age, or if you're trying to lose weight through diet, you'll tend to lose some muscle along with fat as you do that when you limit calories. And when we look at strength training, realize that it's not all created equal. The best types of strength training, especially for promoting fat loss and anti-aging, are going to be powerful or heavier lifts that work especially the muscles of your lower body, and these are going to create the biggest metabolic effect. There is definitely a place for those muscles that work, or for those exercises that work smaller muscles, but these are mostly going to be for doing things like correcting imbalances or aesthetic types of reasons. So we'll go over a little bit of that, but as far as getting the most out of the metabolic benefit of strength training, you want to look at heavier lifting to really tax the muscles and create an overload or an adaptation. And over time, you should be able to increase that load to continue to see results. If you have limited access to equipment, you can always leverage your body weight, and that's going to be a great way to overload your muscles as well. You want to keep in mind that form and body awareness are really important, both to prevent injury when doing strength training and also to get the most out of a workout. So if you're new to it, make sure that you seek some assistance. This type of exercise format consists of periods of high, if not all-out effort, interspersed with periods of rest or low effort. Exercising in this way not only burns a high amount of calories during the workout, but research has also shown a higher caloric burn during the period following the workout. Interval training also promotes increases in cardiorespiratory capacity, which is one of the best indicators of health in older age groups. And in addition, there is evidence that interval training may actually improve cellular health and longevity through beneficial effects to our DNA. For this type of workout, I recommend doing cardiorespiratory exercises like sprinting on a bike or a rowing machine or running, because you can quickly get up to a maximal effort that's unsustainable. Typically, you want to do intervals of 20 seconds up to a minute, starting with just a few intervals and working your way up. You want to play with this intensity of your intervals so that you just start to gas out at the end. And if you're deconditioned or having any medical conditions, this might not be an appropriate modality for you, but you can check with your medical provider. Keep in mind also that a workout class somewhere like a CrossFit gym or even taking a class titled HIIT will probably give you some of these benefits, but it may be skewed more towards strength or endurance, so it won't be a pure HIIT effect like what has been studied in research. I find that mobility is one of the most misunderstood areas of fitness, and I'd say the 2 biggest misconceptions are that mobility is simply how flexible you are, and that mobility is not something to make time for since it doesn't have the same calorie burning effects as strength or cardio. Actually, mobility refers to your body's ability to move within a certain range of motion, so not just the capacity of your muscles and connective tissue to lengthen passively, but actually your ability to activate your muscles in various positions. Trying to just passively stretch muscles without creating the necessary stability and muscle activity at a joint can actually set you up for injury and imbalance. Yoga is one type of mobility practice, but you can also approach mobility from a specific standpoint of working on areas where you lack mobility. People who sit a lot during the day and also people who do repetitive activities like running or cycling tend to show limited mobility in specific areas. For instance, your mobility practice may work toward lengthening muscles in front of your hip that shorten from sitting, or activating muscles in deeper flexion than you would while running or biking. In addition, we tend to lose mobility in certain areas as we age, such as the middle and upper back. This tends to lead to a rounding or hunchback that we often see in older individuals, and have numerous downstream effects on other areas of our posture. Keeping these areas supple and mobile goes a long way toward keeping our bodies younger and functioning properly. A weak core is one of the more common results over time of a desk job or sedentary lifestyle, and is linked to much of the back pain that people experience in older age. When we talk about core strength, we're not talking so much about the visible six-pack muscles that we work when we're doing crunches so much as we are the deeper muscles responsible for stabilizing the spine and allowing the rest of our body to function properly. Movements aimed at core strengthening should emphasize stabilizing your spine while various forces are applied from all directions. Loss of balance is one of the biggest indicators of aging, and improving balance is one of the best things you can do to improve your health and fall risk as you age. So you can try to challenge your balance with both stationary and dynamic exercises. Everyone's body is different, and over time, small issues like favoring one leg or lacking mobility in a certain area can become compounded into larger problems that eventually have us seeking help from a doctor or physical therapist. By proactively identifying these imbalances and working on them, you can preempt a lot of issues later on and improve the overall quality of your workouts. You'll also improve wear and tear on your joints and connective tissues as you age. Some of the most common issues I see are weak external shoulder rotators and postural muscles of the upper back, and tighter muscles in the front side of the body. These lead to a rounded back and shoulders, and also poor head carriage. Unfortunately, a lot of the people I see working out in the gym are actually exacerbating many of these issues by choosing the wrong exercises or leaning into these issues with poor form. There are many simple exercises that will address these issues and help you to look taller, slimmer, and younger. Another common imbalance, especially in people who sit for long periods, is to have weak glute or hamstring muscles, often coupled with tightness in the front hip and thigh. Very often, many people also have a weaker side and will tend to allow their stronger side to take over with certain movements. Addressing these issues directly with targeted and one-sided exercises is the best way to prevent the problem from compounding over time. One thing you might be asking now after watching this is whether there is any reason to include longer periods of cardio in your workouts. I would say there is, especially if you take part in an endurance sport. You'll want to make sure that your body's adapted to longer periods of cardio. However, for most people, I would emphasize getting in those shorter, more intense cardio sessions, and then plenty of leisure activity like walking, kayaking, skiing, or dancing. I hope you enjoyed this video. Thanks for taking the time to watch it.